Hi, thanks for joining. I just got a little topic that I would like to sort of talk about. I think it's an interesting one, and I think it's one that sometimes needs to be talked about. I've talked about, are you okay, and all of those sort of things, and things that are in control. But today, I just wanted to do a little bit of a talk around speaking. I think one of the things around depression is one of those is that you got to talk to be able to get through depression. And in one sense, that's true. You do need to sort of talk it out, and sometimes that will help, especially unburden yourself. We've talked about that. I've talked about that as well. But I think what we sometimes forget is that for a lot of people, speaking, especially about something so personal, is not really that easy. It's not something that some people do regularly, and it's not something that people do habitually. In terms of I think especially for men, it's not something that we sort of take a lot of time to actually practice, to actually do it, and so therefore, when we're then put into that sort of position where we need to sort of talk about what's going on, what's our feeling, what are we feeling, what's happening, what are you thinking about, and so on and so forth. Sometimes it's really difficult just to put it into words, because even if you do know, you don't know what the right words are and whether it's actually making any sense. And so I think sometimes when you're speaking about or speaking about your issues, speaking about depression, it is actually not as easy as what everybody sort of makes it out to be, or what it looks like on the movies, where you just have some psychiatrist sitting there, and then you're on a couch and off you go, and you just everything sort of comes out as if it was just there, right, written in front of you. And that's where I think a lot of times, when you are working with somebody that you know has depression, and you're trying to help them, you do need to have a huge amount of patience. Both for them and for yourself as well. And you also need to praise every little bit that comes out, because as soon as there's any sort of ridicule, laughter, or any sort of feelings of being made fun of or anything like that, people can clam up straight away. And then that moment is lost, and it might take years before that moment comes back again. So a lot of times when we're doing that, when we're trying to work with somebody and we're trying to ask them to speak, just realize that it may not be just that simple, that all I've got to do is just sort of say a couple of words and everybody will understand. But if you're patient and you just praise, and even just sort of say, thanks for saying a couple of things, at least I have a bit of an understanding. Next time we might talk a little bit more. And if next time nothing happens, then just sort of say thanks for coming along, because that might have been a huge effort in itself. So this idea that speaking and we need to speak out of depression is absolutely true, but it doesn't necessarily mean that it's very simple to do. I struggle sometimes to put my thoughts and feelings into some sort of cohesion, and really try and understand it. My wife asks me, I won't say frequently, but asks me now and again, how are you going? What's going on? And especially that will be maybe around when I'm looking a bit down, or feeling a bit down, or just acting a little quiet. And sometimes I have got no clue why I am quiet, why I'm down, why I'm feeling the way I'm feeling. And I can't articulate it. All I can say is that I'm not feeling great, or I'm not feeling comfortable or confident, or whatever it happens to be, or I'm not feeling happy. And sometimes that's good enough. At least you're vocalizing that you're not feeling great. People can then understand that if that's happening, well, maybe something else is happening as well, but you just can't verbalize it. So sometimes it's just those little things that, even if somebody sort of says, oh, I'm just not feeling great, that's fantastic. They've at least told you something, and you can move on from that. Sometimes you can follow up and you might get something else, but when they start to sort of be silent again, don't make them feel bad about that. Just sort of say, okay, that's great. At least you know what's going on, and I know a little bit, and so I know how you're feeling. So that's fantastic to hear that. And then you can sort of move on the next time. sometimes these things aren't easy, and sometimes it's harder even when you're talking to somebody that you actually care about, because you don't want to hurt them. You don't, somebody who's cheerful around you the whole time, you don't want to sort of say, oh, I'm just feeling down and I don't know why. Those people, that person, even though they might be looking up, has still got self-confidence, self-esteem, self-worth issues, and if they sort of take that the wrong way, they might feel down, and that's what you're thinking as well. It's like, well, why would I want to bring that person down? But don't try and think about it like that, whether you're the listener or the person who's trying to talk. Just try and say a few things, say it one word at a time if it happens, and that's a great thing. So just do your best, and hopefully the person who's listening and working with you will be a good listener as well. So, I encourage you all to speak, but just do it at your own pace and make sure that you just talk about what you need to talk about. So thank you, good luck, and hope to talk to you soon again.